welcome to Geetika Ki Canadian Diary. If you're curious about entrepreneurship, purpose driven work, or the power of collaboration, this is an episode you do not want to miss. From the story behind their name to the impact they hope to create, this conversation is all about what it takes to turn an idea into something that resonates with people. Joining me today on my podcast, I have the founders of Unum Co, Megan Marsiglio and Farah Meghji. Thank you for making time.
Thank you. Thanks for having us.
So my very first question, how did Unum Co become a reality from an idea? Tell me the gaps you both saw and needed to fill them.
Yeah, thanks, Geetika. Thanks so much for having us. Megan and I met about 7 years ago when I was working in the life sciences pharma industry. And at the time, I was becoming more aware of patients and people who were telling the stories of their journeys in social and digital spaces and communities. And historically, these weren't places that pharma would go to when we wanted to understand the lived experiences of patients. And I came across Megan's blog at the time, and she was talking openly about her journey with IBD. And I connected with her, and through that connection, really learned about how many, and I'll say women specifically, were really looking for and finding community and education and support through these online spaces. And so as Megan and I got to know each other, we worked on a couple of projects together when I was still in my role. And every time we got together, we would start to think and brainstorm and really ideate about what it could look like if we were to reach out and tap into voices that were really underrepresented and not always listened to and brought to tables where healthcare decisions were being made. And so over the years, those conversations really led to the founding of Unum.
Mm-hmm. And I should also say that, well, IBD is inflammatory bowel disease, so Crohn's disease and ulcerative colitis. But prior to meeting, Farah and I both had a lot of experience in patient public affairs, patient advocacy, patient engagement. Yes, I had my blog, The Gut Gazette, I still do, but I also, as my career, was working in patient public affairs. So we had a lot of alignment and similarities in what we did prior to deciding, let's start a company.
I want to very quickly touch base on your own struggle, Megan, that it took a long time to diagnose what you had. And especially as women, sometimes we internalize our own pain as, you know what, maybe I'm thinking too much. Let me not focus on that. And as we get older, instead of being more careful about our own health because we're taking care of so many people in the house, we put ourselves really back in the line. And subconsciously sometimes it's or culturally or it's just a personality. Tell me more about how did your diagnose happen? How long did it take, and who had to advocate for you?
Sure. Yeah, I was in my late teens when I started struggling with digestive issues, and I was wrapping up high school. It was quote unquote anxiety and stress of high school, as my doctors told me. I wasn't having any alarming symptoms like blood in my stool that would send me to the ER to probably diagnose me quicker. So I just lived with pain and diarrhea and urgency for a couple years until, my parents were like, we need more tests. We need to get inside and see what's going on. So was referred to a gastroenterologist. He even kind of brushed it aside at first and said, listen, it's probably just IBS, irritable bowel syndrome. It's probably stress and anxiety. You don't have to worry. But once I had a colonoscopy, they did discover that it was Crohn's disease. And you're right, Geetika, a lot of the times people or, and especially women, they will get gaslighted into that their symptoms are not as bad as they actually are. And that's when a lot of misdiagnoses can happen. But I ultimately got diagnosed in my first year of university. I was very ready to learn this diagnosis and very grateful to know what I was dealing with. And once I got that diagnosis, it kind of sparked a advocacy and I guess just self-advocacy, but also a passion to destigmatize what I was managing and to destigmatize digestive diseases in general. And I got into patient advocacy, and it kind of triggered the rest of my career.
Thank you for sharing that personal story, Megan. I am so proud of you, and thank you to your parents for advocating for yourself and not thinking, oh, everybody around knows my body better than me.
Exactly.
That's
You
what
know your
happens
body
sometimes.
best. Trust
Yeah.
your gut.
So if someone listening to us right now lands on your page for 10 seconds, what should they immediately understand about what you both do?
We turn patient experience into strategy. So if you work in pharma, health tech, biotech, you know that patient engagement matters, but you may not know how to turn it into action. And that's where we come in.
We give help in different languages. Something
Yeah,
to
we've
think
actually,
about.
sorry?
Something to think about.
Yeah, absolutely. And Geethika, it's such a good point because we've actually worked in a couple of spaces where we've seen patient education resources and tools simply just being translated into different languages. And through these experiences, have learned that in order to make patient education and support more accessible for communities, it takes more than just translation.
Mm-hmm.
Absolutely, yeah.
So one of the things we're really trying to do is to reach out to communities and really understand, cultural nuances and things that really impact how information is shared, is understood, and then is acted upon.
Absolutely. There's so many resources. I sometimes realize that even if you hand it over to the patient, uh, they may not read the whole thing because they actually don't know what's in it. So sometimes you have to like advocate for them, like read the pamphlet that I gave you. It's in your language. Ask me questions. Don't be afraid to ask a question. Because in my culture, you don't ask questions to a doctor or a teacher. You just take advice and you do not want to contradict anything.
That's
So
right.
that's where sometimes cultural sensitivity comes like, oh, it's okay to let them know that they can ask if there's a question or they have a doubt about something. It's not like, oh, I'm not being respectful here.
Mm-hmm.
So what does a typical engagement look like? Give me a client example.
It's a great question. And I will say that, it's hard to say sometimes typical engagements because I think that the work we do is so tailored and customized for the organization or the patient community that we're working with. We've done things from helping patient organizations build their digital and social communities to helping national or pan-Canadian organizations create education around long-term care through we use video, we use social media, we worked in traditional media before. We've helped organizations support the work they're doing from a patient partnership level internally. So, I think while engagements don't always look typical for us, I think the red thread that really is consistent across all of the work we do is that we understand the lived experiences of the communities we're working with, and we translate those into campaigns, activations, impact for the organizations that we support.
Yeah, and engagement not just with patients for patient communities, but also internally. So we've worked with some pharma companies to educate their internal stakeholders about what good patient engagement looks like so that they're fully aligned as an organization.
according to both of you, and you can decide who takes this question first. What has changed in the healthcare world in Ontario over the last decade or so that you will consider as a positive step when it comes to patient voice?
Yeah,
You want to
I
take it,
mean,
Farah, first, maybe
sure,
from
I'll start and then
pharmaceutical?
I'm
Yeah, okay.
sure, yeah, Megan has things to add to it. I'd say there's a few things. So first, I mean, of course, the pandemic really changed a lot about how healthcare is being delivered. So for example, we're seeing a lot more organizations support patients from a virtual perspective, as well as in person. And I think this has absolutely, it's come out of necessity during that time, but I think it's also changed the landscape around accessibility of healthcare services. So that's definitely one thing that's changed, I think. And Megan alluded to this previously when we were talking about how we got started as an organization. Both of us have worked in patient advocacy and experience for decades. And so we've seen the evolution of patient, I'll say, inclusivity, patient centricity being this term that I think we've heard about for a long time, but we're actually seeing things come into practice because of this. For example, we're seeing, regulatory and funding bodies in Canada and in the province seek patient input and feedback on drug submissions, on policies. We've seen hospitals create patient and family care, advisory committees and that sort of thing. So we're absolutely seeing the practice of patient engagement and the inclusion of patients increase over the last 10 years. And then I think the biggest one, of course, is AI and how that is changing not just the improving efficiencies and healthcare delivery in many of the tools that AI is supporting. I think it's also starting to, in small ways now, but in probably big ways very soon, we're seeing how it's giving patients accessible healthcare information. And, when patients would Google things and Google symptoms and show up to their appointments with that information, I think this is really taking that to the next level. This is on a personal, level that is actually going to, I think, support patients in a way that we haven't seen before and empower them with more education and support.
I think it's a good point because when you do Google search, I actually want to make sure here that people don't get a wrong message about what we are trying to say here. Not everything that AI is going to bring up on your screen is going to be facts or right or
Absolutely.
true. So good idea when you do the Google search and you're having a doctor's appointment, please go and ask those questions. Don't just assume that that's what I'm going to start doing now. So that was a good point there. Megan, you wanted to add to that.
I mean, Farah said it very beautifully, but I think overall expectations have just shifted. 10 years ago, patient engagement was largely tokenistic. I still think that there is a lot of tokenism in patient engagement and the way that patients are brought on as partners. But, people see how crucial it is to have patient voices at the table, and they're doing it differently. And there's still a lot of work to be done, but that's what has given us a lot of confidence to build Unum Co and to bring our expertise to the table.
Yeah, it's amazing sometimes when I look around, there's so many platforms that actually cater to one particular cause, and there are people who can share their stories so you don't feel like, oh, I'm alone in this journey, or maybe have doubts and then you can clarify. Um, it's a big positive step, I think, in that way.
Mm-hmm.
Before we wrap up, I want our listeners and viewers to know, when is the next snack break? What is it about? And also about the magazine Unison.
Yes. So our snack breaks are virtual meetups for anybody who is a patient, a caregiver, anybody who works in healthcare, patient advocacy, to just come and connect and to share their experiences and to know that they're not alone. We just recently had our last snack break this week, but the next one should be in the book sometime soon. If you're interested in it, you can send us an email, hello@unumco.ca, and we can make sure that you are part of the next one. And then, yes, we have a magazine. It's a digital magazine called Unison. It's a spot where we gather stories of patient experiences and people who are making change in the Canadian healthcare space. And yeah, you can check that out as well. It is on our website and on our social media platforms. And it's a quarterly publication. So our next one will be coming out in June.
Although I should have asked this question at the very start. What does Unum mean?
Yes, unum means together or togetherness in Latin. So when we were coming up with a name, our whole, I guess one of our values for our company is that Farah and I can't do what we're doing alone. We really need to get everybody together, using their voices, sharing their experiences to make change in the healthcare space. And we love collaborating, working with other people. And that's where the word Unum came about.
Both are doing fantastic work together, let me tell you that.
Thank you.
Thank you for your advocacy. Really, really appreciate it. Thank you for your time today.
Thank you. Thanks for having us.
Take care. Bye-bye.
Bye.